I'm joined by Dr. Suzan Cheng, board-certified radiation oncologist with Morris Hospital and Healthcare Centers. Dr. Cheng practices at the Radiation Therapy Center of Morris Hospital at 1600 Route 6 in Morris. Great to have you with us as we want to talk. The month of September is Prostate Cancer Awareness Month. We want to spend a little bit of time talking about prostate cancer. How prevalent is it?
It's so prevalent that 1 in 8 men will have prostate cancer during their lifetime, with more probably undetected. So the interesting part is it is the most frequent cause of cancer death among men behind lung cancer in America, but because there's more and less aggressive ones, we know that about 3.1 million men are living with the prostate cancer. So if you have a not so aggressive prostate cancer, not only are the chances of you dying of it are very small, but there's a lot of you. So we treat a lot of it.
Well, of course, as with many diseases, ailments, we've learned over the years that prevention is the best way to go about protecting oneself from prostate cancer. What can guys do to prevent it?
Well, there's one fun fact that came out probably more than 20 years ago, which is that men who ate more tomatoes had a lower incidence of prostate cancer. So go get that pizza and that pasta. And
wow, okay.
It's probably the antioxidants.
What? Okay.
There's a lot of work on preventing prostate cancer. As for most cancers, it's long thought that having normal vitamin D levels is one of the things that may help you not get prostate cancer.
Okay.
But more importantly, there are active studies checking certain testosterone changing drugs or selenium as a supplement that may decrease your chances of having it. So there are active studies, but interestingly, we've never been able to prove that smoking increases your risk. Smoking does not, unlike, by the way, bladder, stomach, or breast cancer, which are related to smoking.
Okay.
We don't really have the evidence, for example, that being overweight increases your risk of getting cancer, whereas in women, for breast and particularly uterine cancers, weight can really matter.
What about screenings for prostate cancer? What can you tell us about those?
Right, and we love to do the free cancer screenings at least once a year, most hospitals, including ours. And what you find out is that if you have a relative who had prostate cancer, your risk automatically doubles. So a male relative with prostate cancer. And it's even more than that if the relative is your brother versus your father.
Okay.
And then the last message, which I give to a lot of people, is if you're a man but you've got a relative with breast cancer and you have a lot of different cancers in the family, those genes that we check in nearly all breast patients code for even prostate cancer, pancreas cancer, colon, stomach, uterine, so that some of these genes in a family that increase the risk for cancer go to both genders, male and female, and all those different cancers. So it's really good to know what's going on in your family. Again, because if a bunch of you men have the prostate cancer and you've got a relative coming up in his 40s and 50s, that person probably needs a PSA, which, by the way, the recommendation is to have the first one at age 50 unless you've got that relative. Then you can get it by age 45.
Are there warning signs for prostate cancer?
You know, men tend to have enlargement of the prostate, so the bladder symptoms of frequency and urgency are pretty ordinary. But your family doctor knows when to get that first PSA, prostate-specific antigen blood test.
Okay.
And so even though there's a normal level of 4 in most labs, it changes depending on what other drugs you're on, even some natural supplements, or whether you have an extra large prostate where your baseline PSA level may be higher than normal. So you need a doctor to figure out when should you get the PSA test, what's high, and then if you check it once a year and it's increasing, when does that matter? When does that trigger a test for the actual cancer?
And what about treatment options for prostate cancer?
The good news is that you do have a lot of choices, and it would be not doing anything. For example, if you are very elderly and you have a low-grade cancer, you might not need any treatment. because you're just not going to die of it, and that is a reasonable response.
Okay.
There is having your prostate removed, which in some cases could permanently alter your erectile function, which matters, or we can do a shorter course of radiation and put radioactive seeds in the prostate itself in the operating room that ultimately go away after a month or two. The radioactivity goes away, but it literally treats the prostate with a high dose. And if you're lucky, you might even just have just the seeds. So it's a one-time implant. We call it a seed implant, a one-time procedure. And all those can be curative.
Very good. Anything else before we conclude today?
Just that there is constantly new things, and the latest thing that all of which is available in this area are the new PET scans, of which there's at least 2 approved and others coming where you go to a radiology department, they inject you with a dye that goes specifically to prostate cancer cells.
Okay.
And so we can check whether the cancer is still in the prostate or whether it's spread, and these are brand new. One was just approved a few months ago.
Fascinating stuff, Dr. Cheng.
Yes.
Yeah.
Very exciting.
Yeah, all right. Well, thanks for spending some time with us. Certainly appreciate it.
Always glad to. Thanks for having me.
Morris Hospital is accredited by the Commission on Cancer of the American College of Surgeons as a community cancer program. Dr. Cheng and the staff at the Radiation Therapy Center guide patients through cancer care treatment with warmth and understanding. Morris Hospital ensures access to comprehensive care, state-of-the-art services, and equipment and a multi-specialty team approach. To learn more about the Radiation Therapy Center of Morris Hospital, please call 815-364-8915.